few months ago, I thought I had appendicitis because I was just getting like this like sharp sort of pain that was kind of started here, right like iliac crest area, and it was kind of radiating down into my stomach, down into my belly button, and even down to my right testicle. And I thought it was appendicitis. Went to the emergency room. They confirmed, okay, it's definitely appendicitis. They did the leg test and whatever, the visual test, and they started running further tests on me. They couldn't find anything wrong whatsoever. They had no idea what it was. I think it might be related to my lower back. But even now, like, it's not so bad right now, but if I palpate here, like, it is sharp. It burns. It's like I put pressure right on this. I don't know if it's a nerve or something, but it causes a lot of pain. Like right in this area, right where I'm pressing right now. And there are times, especially with that, it was so bad, like even if I pressed a little bit, like, it would sting, it would burn, even the slightest little bit of pressure. Not terrible right now. So there's that, and while I'm sleeping, laying on my back, on my side, I have to constantly readjust because I'm always in pain. Always in pain. I have to move and constantly just twist around to try to find some level of comfort. I try to run as much as I can, try to exercise as much as I can. I'm not lifting weights. I have to actually banish weights. I'm doing like all like body weight training and resistance training and a lot of stretching. But stretching, you know, that actually causes some of the most pain, especially when I stretch my back. Trying to stretch up my hips or any of those stretches that I'm supposed to be doing, and as soon as I get up, I just start to spasm immediately. Sort of just shoots up, and I kind of have to just get up in a certain way. It's very different from what I'm used to. Like it's actually really affecting me.
So, on the first pass, we saw a lot of erratic readings over here. So what we do is we're going to tilt the scope and see what shows up. So we see a small little reading at this level. Another reading over here. So since the patient was talking about a burning sensation and pain right at the outside of the iliac crest, there are two potential nerves we'll talk about. It's either got to be the iliohypogastric nerve that comes off either at that 12th dorsal or the first lumbar in this upper part region over here, or it's the lateral cutaneous femoral nerve. Also traces along the same pathway to the outside of this. So yeah, I really want to take a closer look, see what's going on in this region over here, in addition to what's going on in the rest of the spine over here. So we feel some pitting edema over here. Start to get sinks in over here. So we mark that level. See here at this level as well. And we clearly see right off the bat with the viewers over here, there's a big band of swelling on this level over here. Feel that left side? That sacral? That ain't moving whatsoever. The right side moves fine. Right hip moves fine. Left hip, it's actually moving just fine. But that left sacrum, that's a brick wall. And when we palpate, how's that fifth lumbar?
It's painful.
Painful, get it. So move along the path. See, everything I hear, it's a brick wall.
Oh, that one, yeah, that's...
This is the most painful.
That's very painful.
And everything else still continues to be like a brick wall. So we have the whole entire biomechanics of this whole entire spine here. It's compromised. So we're gonna figure out what's going on all the way down there. So I understand you told me, said, yeah, you got a lot of pain over here, especially really burning pain on the outside here. And on top of that, that groin pain over here. A lot of pain in this region over here. Same deal over here as well. As we discussed before, I want to take a closer look in this region over here. Why? Because the iliohypogastric nerve, it comes out branches of the 12th dorsal and the first lumbar, and it comes straight out to the outside right over there. So that could help explain why you feel all that pain sensation, just like we see on the opposite side over here. It goes right on the outside component of it.
So yeah, I want to take a closer look. What the heck is going on in this region over here?
That would also probably explain why I get like some pain on the outside of my hip sometimes too.
Exactly.
Yeah.
So there's something going on here biomechanically that's severely compromised.
Yeah.
And the lower part over here, yeah, I want to take a look what's going on over here. So since we already identified and we tested that left side of the sacrum is jammed up, it can mimic and cause that groin pain in addition to that right testicle pain as well.
Mm-hmm.
So looking at your x-rays over here,
Mm-hmm.
this is what normal is supposed to look like. I want to see this.
Right.
What I see is, see all these angles? It's too severe.
Yeah.
Why? So when I take a look at your foundation itself, and we already tested and confirmed it,
Mm-hmm.
your foundation is not stable.
Mm-hmm.
So since it's not stable at all, everything else starts to be affected as well. However, the way your body compensated, and you also experienced some kind of trauma, what I notice here, your 12th dorsal, 11, 10, 9, and 8th, every single one of them experienced a compression fracture. I want to see it like this, a nice beautiful rectangle shape. The back of it and the front of it should be the same size. And yet when we take a look at the number 12 over here, it's wide on the back, narrow in the front. Number 11, wide in the back, very narrow in the front. See this over here? I could put like 3 fingers here.
Mm-hmm.
I could barely put just 1 finger over here.
Mm-hmm.
Same thing, the 10th,
Mm-hmm.
nice and wide here, very narrow in the front. 9, wide in the back, very narrow in the front.
Mm-hmm.
Number 8, wide, narrow. So 8, 9, 10, 11, 12, all these, they got squished. Right. Normal, we want to see this.
Mm-hmm.
And yet your spine is doing like this.
Mm-hmm.
You're starting to develop a good old, grandpa's hump going
Yeah.
on. Right?
Yeah, I don't want that.
But you're a very young age.
Yeah.
So why? Because this region over here, bam, compromised. So everything starts collapsing. That's why you see all this going on over here. So what we're gonna do for you is this. Our strategy is we gotta restore the foundation down here, and we're gonna restore the bottom, the structural support here. Restore the biomechanics. So push this instead of being slashed like this,
Mm-hmm.
more upright.
Right.
And on top of all that, also help alleviate that nerve, what you're feeling that's being pinched off. To help explain why you felt that burning sensation over that right ear, that crest you got going on.
I feel like there's a little lighter on my left hand side. That's the best way I can describe it. It just like immediately feels like just a little. It's almost like I'm slightly unbalanced, but I feel like on this side of my body now I just feel lighter in general. It's kind of hard to explain.
Just relax a little bit more. Just let it all go. Here's a piece. Just go ahead, breathe. The reason why we did a spinous contact is because due to the compression fracture over here, we don't want to cause any potential other issues or further complications to that structure over there. So since the spinous process is the most strongest contact point on the vertebrae, that's why we made that contact over there. Now we're letting the patient relax and rest over here is because now that we restored the proper biomechanics, right, restored from the foundation and here in the dorsal lumbar region over here, we need for his spine to relax, have the cerebellum reconnect and reestablish to the rectus spinae and the postural muscles over here, so that when we do put him upright in a weight bearing position, there won't be a huge shock to over here.
Like I felt like there was like blood rushing to my head, and I kind of felt out of balance for a second.
How's it now?
It's getting better. It's getting better. I'm clearing up now, but it hit me hard, and I actually feel like my breathing is, that's also pretty noticeable. Like my breathing is a little bit better almost immediately. Like the breaths just feel more natural. Like they feel like more quality breaths. Yeah.
Because bear in mind, the way your spine was, because the way that all the traumatic injuries you had, you're more like this.
Mm-hmm.
So your center of gravity was way backwards. So now that because we restored your biomechanics and the center of gravity over here, That's what you feel. It's like, whoa, you know, it's like really dizzy.
Yeah, definitely. Very dizzy, but it's getting better now. I feel clearer now.
Yeah. Try setting up. See how that's for you.
I mean, I feel good.
How's this right now?
Well, it's not really like apparent, you know. I don't, you know.
I'll tell you what. You mentioned that you have a lot of trouble sleeping at night. So how about this? On the following visit, give us an update.
Okay.
See how your sleep is like.
Okay. Sure. Okay.
Right. Anything else?
No. That's it.
Right.
Thank you.
Well said, champ.
Thank you. Appreciate it.
You're very welcome.
Thanks a lot. Thank you. Well, since the last visit, I could definitely sleep a lot better. The first night was a huge improvement. The second night was an even bigger improvement. That was a big thing, considering, you know, I had a hard time sleeping over the past couple of months, constantly twisting, turning, always being in pain, and that actually went away almost. Like, I'm gonna give it like maybe like an 80%, like within the first night, which was great. I don't have that pain, same singeing, burning pain from that. I forgot the name of that nerve.
Don't worry about it.
But I don't. Yeah, there we go. That's not there anymore. It's alleviated, you know, and it's doing great so far. You know, just hopefully let's see what happens down the line.
All right, you got it. Let's get to work.